1, 2, 3, 1, 2, 3, 4. Am I in your spot?
No.
Are you getting started? 1, 2, 3, 4, 5. Mic check. 1, 2, 1, 2, 3. Sounds good?
Yeah.
Sounds good?
I'm good.
You're good?
All right, hold on one sec, please.
No worries.
I'm gonna count.
Tangle in my head.
I'm gonna count down from
Go
10,
ahead.
9, 8, 7. Mic check. 1, 2, 3. 1, 2, 3, 4. 1, 2, 3, 4, 5. Mic check. 1, 2, 3, 4.
Perfect. Thank you so much.
Awesome. Great. And on.
Just on the third block, we just have a designated speaking spots and
Exactly. We'll call you. Yep.
Soon, yeah, 3:05 will be open. Wait. Oh, 2 minutes until we'll begin, please. Thank you. 3:05. Almost there, guys.
Toddy? Yeah. Well, you know.
Everybody gets spot on.
Big, that's spot on. Oh, here comes Scott. I got a 2-minute warning. No whole box. There's a whole box? They're live streaming, so you can't be on
Like, we can try to move some chairs.
Yeah, we got about a minute left until we're starting. Start? Yeah, it's 3:05, yeah. Read what?
Read your message.
Oh. I won't do not disturb. Okay. All right. We're going to have a few more members of the media get ready before we start, so just 1 or 2 more minutes.
once he's all set up.
Yeah, he said he's good.
Okay, perfect. Yeah.
Okay, everyone ready? All right. Thank you guys so much for being here today. My name is Kate Esqueda. I am one of 2 community outreach specialists here at Hays County Health Department, and today we are holding a press conference regarding the confirmed measles case in Hays County. Today we will be discussing the case, answering any questions you may have, and just providing some general measles information. Firstly, we'll have Matthew Gonzalez, the Executive Director of Hays County Health Department, speak, and then we will have Gabrielle Legel, one of our epidemiologists, speak to inform y'all and answer any questions you may have. So first, we will have Matthew speak.
Good afternoon, everyone. As Kate introduced me, I'm the Executive Director for the Hays County Health Department. We serve the entire Hays County jurisdiction. So to begin the present the press conference, I would like to discuss the positive measles case and how it originated within Hays County. We were notified on Friday, May 16th of a potential suspect case of measles that presented at Ascension Seat in Hays. We are asking individuals who visit the hospital between 12:30 p.m. and also 5:30 in the afternoon to self-monitor for signs and symptoms of measles. The department is working with Ascension Seat in Hays and also another potential exposure site of Communicare to identify patients and staff exposed for potential signs and symptoms and also for potential treatment. What I would like to do is kind of give a timeline of events that we occurred here at the health department trying to navigate and investigate the case for the first positive case of measles in Hays County. The patient developed a rash on May 15th, 2025. Individuals with measles are contagious 4 days before they develop the rash and 4 days after they develop the rash. Therefore, our patient that we're discussing here today was contagious between May 11th, 2025 and May 19th, 2025. The individual, we're going to be discussing some potential exposure sites, and so what I want to clarify before I go into that is that the individual was not considered infectious during visits to the following locations prior to May 11th. The locations are only being included out of an abundance of caution due to the small possibility of early transmission that may have not been detected. On May 10th, the individual visited the Sephora inside of Kohl's and Kyle at the address of 20185 Marketplace Avenue, Kyle, Texas 78640, sometime between 8 a.m. and 4 p.m. The individual also visited HEV Plus in Kyle at the address 5401 Farm to Market 1626, Kyle, Texas 78640, sometime during the same time frame of 8 a.m. to 4 p.m. This means that individuals who visited these locations between 8 a.m. and 6 p.m. may have been exposed. The virus can stay in the air for up to 2 hours, so 2 hours are always added to the exposure time frame. Now we're going to be discussing the locations that the individuals were present in during their time of infection. On May 13th, the patient visited the Communicare's Kyle Clinic at the address of 2810 Daisy Lane, Kyle, Texas 78640 from 11:47 a.m. to 12:23 p.m., making those who visited the clinic potentially exposed from 11:47 to 2:23 p.m. Also on May 13th, the patient visited the Texas Department of Public Safety sometime from 8 a.m. to 1 p.m., making those who visited the clinic, the DPS site potentially exposed from 11:47 to 2:23 p.m. On May 16th, the patient visited Ascension Seat in Hays Hospital at the address of 6001 Kyle Parkway, Kyle, Texas 78640 from 12:50 p.m. to 3:30 p.m., making those who visited the hospital potentially exposed from 12:50 p.m. to 5:30 p.m. Again, so the Hays County Health Department received notification about the potential of a suspect case on Friday, May 16th. On May 16th, we instructed the providers at the Ascension Seat in Hays Hospital to collect 2 samples to be sent to their organization's lab, as well as another sample to be sent to the Department of State Health Services. The Ascension Seat in Hays did submit their specimen meant for their private lab on that same day, and then we, the health department staff, helped Ascension Seat in Hays get another specimen transported to the Department of State Health Services laboratory located in Austin. It was then on Austin that we received, on Monday, that we received a positive notification of measles for this patient. What I want to do is talk about and emphasize our containment actions. So I want to emphasize our response plan, the investigation, treatment, and prevention. Staff have already begun the investigation of the patient as well as any potential contacts. We have, so far, all organizations involved with exposure have been cooperating in our investigation, providing us what we call line lists, which have information about individuals and their contact information and times that they may have been exposed, so that way we can conduct a thorough investigation and make sure that we reach out to these individuals to ensure that they get proper treatment and or can monitor their signs and symptoms. We are working with the Department of State Health Services to identify opportunities to offer post-exposure prophylaxis treatment to patients who were exposed to the patient. If and once available, the post-exposure prophylaxis we will be offering is the MMR vaccine for individuals within 3 days of exposure to the patient and 6 days for IG for those exposures and future exposures. So what I want to do next, after talking about the enforcement of containment and making sure that individuals were not going to be further exposed or infected by the individual or others, I want to talk about the risks to our community as well as individuals, what they need to know in order to prevent that. The most at risk of individuals are those who do not have prior evidence of immunity. Examples of this include proof of vaccination, or they were born before 1957, or previous history of having measles. Additionally, those who are immunocompromised, pregnant, or too young to receive measles vaccinations may be at a higher risk. What we want to do is stress the importance of getting vaccinated for measles. The Advisory Committee on Immunization Practices recommends that all children and susceptible individuals without evidence of immunity receive the measles, mumps, and rubella vaccine to prevent measles infection. Children should receive 2 doses of the MMR vaccine. The first dose is at 12 to 15 months of age. The second dose is at 4 to 6 years of age. Adults that are born in 1957 or later without evidence of measles immunity should receive at least 1 dose of MMR vaccine. And then other high-risk groups such as international travelers, healthcare personnel, and students at post-secondary institutions should also receive 2 doses. As clarified earlier, evidence of immunity includes written documentation of an adequate vaccination, laboratory evidence of immunity, laboratory confirmation of measles, birth before 1957, except in high-risk settings where vaccination may still be indicated. And then lastly, I want to talk about the treatment, which is post-exposure prophylaxis, or PEP for short. It's a form of intervention which is used to prevent symptoms of measles from developing in someone who was exposed. PEP is available in 2 forms to those who may have been exposed to a contact. Up to 3 days after the exposure, a contact to a case of measles can receive a measles, mumps, and rubella vaccine, or MMR vaccine, as a form of PEP. Up to 6 days after being exposed, an injection of immune globulin can be given to prevent measles. Who's going to be talking about that a little bit further, about the epidemiology of measles, is going to be our epidemiologist, Gabriella Gell.
As Matthew mentioned, I'm an epidemiologist with the Hays County Health Department. I'm the respiratory epi here, and my name is Gabriella Gell. Measles, also called rubella, measles, also called rubiola, is a highly contagious virus that spreads through the air and can linger on surfaces for hours. Symptoms typically appear 7 to 14 days after the exposure, and some common symptoms include a high fever, cough, runny nose, red watery eyes, and the hallmark symptom being a rash, which first appears at the face and hairline, then travels downward to the neck, trunk, and finally extremities. While most people recover within 10 days, measles can lead to serious complications, especially in young children, those children who are under age of 5, and individuals with weakened immune systems. In rare cases, it can be life-threatening. The measles, mumps, and rubella, or MMR vaccine, is a safe and highly effective way to prevent infection. It is recommended as a 2-dose series during childhood, where the first dose provides 93% protection, and the second dose increases protection up to 97%. For individuals who have been exposed and are at high risk, post-exposure prophylaxis, or PEP, may be available. This intervention can help prevent illness if given within a specific time frame after the exposure. Those most at risk include unvaccinated individuals, children under 5 years of age, and people with compromised or weakened immune systems. We are actively working with the locations where exposure may have occurred and doing that to identify and notify individuals who may have been affected by an exposure at one of these sites. If you develop symptoms and have visited a known exposure site, we strongly encourage you to contact the health department immediately.
I just wanted to notify everyone that this information will be available in Spanish in the next few days. En español, la información de que estamos hablando hoy estará disponible en nuestro sitio web de Hays County Health Department en los próximos días. Muchas gracias.
Alrighty, without all that being said, what we're going to do is open to a period of questions and answers. We'll go ahead and start whenever the media is ready for questions. I'll start right here. So the individual was not vaccinated. So just to restate that, the question was whether or not the patient was vaccinated, and we are considering them not vaccinated. And the reason why I say consider is due to that criteria that we talked about, that we need the individuals to be able to provide proof that they were immunized. This individual was not capable of providing us valid proof that they were immunized. So right now we are considering them unvaccinated and unimmunized. Yeah, I'm going to go ahead and let one of our EPIs answer that question.
The patient is.
Come to the podium.
And identify yourself.
My name is Madison McClary. I'm an epidemiologist with the Hays County Health Department. Last we heard, the patient is feeling much better and back to feeling good. So.
Sorry, I'm going to start right over here real quick. Yes.
Do you know how that patient was exposed to the virus?
Yes. So at this point in time, we do not believe that the patient was exposed to the virus through the current outbreak that's going on in Gaines County out in West Texas. They did inform us that they believe that they were exposed through an extended family member who they visited 15 days prior to becoming ill.
Where did they visit them?
Let me just say, if you know.
Their extended family member, they did mention, was within the county.
What about are there any areas in Kyle that might be considered of risk that if people were there around that period, they should be, aware of, or like any possible, I guess you call that exposure risk?
Currently, the only exposure sites that we know of, we have provided in the press release, and again, those individuals who visited HEB or the Sephora inside of Kohl's, both of those locations being in Kyle, we don't consider very high risk of contracting measles, but we did include it just out of an abundance of caution to give us kind of a buffer window since it was one day outside of their infectious period.
Locations that you mentioned, is there any danger other than if that individual is no longer there, is the danger of being in that location also gone?
Yes, both of those locations are perfectly safe to visit now. With measles, Matthew had mentioned earlier that we do add a 2-hour time buffer to after a person has left because measles can circulate in the air for up to 2 hours even after a person isn't in the same airspace.
Are there any mitigation efforts that are underway, or have there been any on those locations just to be sure the air was clear?
Yeah, so at the moment, we're working with all the exposure sites such as HEB, Communicare, Ascension Seton Hays, and Sephora, predominantly to identify if there are any other exposed individuals, because that's where the risk is going to be, is whether or not individuals who work there or consistently travel to be either a patient or customer at those locations, if they are exposed at the time of dates that the patient visited and they are starting to develop symptoms, then that's the risk that's there. But whether or not there is any infection from the virus itself from the patient's original date of exposure, there's not any there.
So you've isolated the individuals that were working there at the time that they visited?
So unfortunately, we aren't able to go back in time to, say, hey, you need to not come to work, because typically we're going to have a 2-week development time for incubation of the virus. So all we can do at the moment is to, work with the media, work with our community partners, work with the organizations who are there, distribute literature and information to their patrons and their employees to let them know what the signs and symptoms look like, so that way they can self-monitor to ensure not to return back to work or to go back to those places.
And can you just for clear, go ahead.
Yes, Richard Webner from the Express News. Can you give more information about the patients, such as the age, gender, whether it's a student, what school they might go to?
Yeah, so the only thing that we're going to be able to really disclose is that the individual was an adult patient. Other than that, we are trying to keep information very limited, since it is the first case of measles in Hays County. We want to make sure that the individual doesn't get exposed by any types of demographic information to protect their HIPAA rights and privileges.
So just one case, obviously, sounds like y'all are getting ahead of this by having this press conference, not kind of thing. So just with that said, what do you think the biggest takeaway for people watching this conference right now, or particularly watching this story tonight, should take away?
Yeah, I think the biggest message that we want to get across for having this press conference is that obviously we have been watching this, across the state, whether it be in West Texas, South Texas, or even up north. What we want the community to know here in Hays County is to be aware of what the signs and symptoms of measles look like. So again, you're going to potentially develop a fever, potentially develop a rash, and or conjunctivitis or pink eye. And so one of the things that we want our community to be aware of is those symptoms, so that way they can either isolate themselves or work with their medical professional or medical home to make sure that they either get tested for measles and or quarantine themselves before they are able to transmit it to other individuals. The other thing is to let individuals who are immunocompromised aware, or those who are going to be vulnerable, so pregnant mothers and youth, and making sure that they have the adequate precautions. Thankfully, we're about to enter summer for many of our school districts, so what we're going to be doing is, of course, monitoring to see if any individuals were exposed were minors who are still currently in school. However, it does help us that individuals are going to be leaving for summer and currently in the school districts. So again, main message being it's within our community, whether as a singular patient, but we want others to be aware of what the symptoms look like and make sure that they understand the risk that it poses to them, so they can take the proper precautions.
And I guess that obviously means just a good reminder that if you're not vaccinated or you're on the fence, hesitant about being vaccinated, this is as good of a reminder as any.
Yes, absolutely. Always the easiest way to prevent yourself from getting measles is going to be getting a dose of the MMR vaccine.
Just to make sure I understand, so you said that it is not believed that the patient was exposed to the virus through the current outbreak in West Texas, that the patient believes that it was from visiting an extended family member here in Hays County. I mean, did you know, did that person have measles, or has that person been tested in any way?
So we have not been able to determine whether or not the family member that the patient is talking about did have a measles case, and whether or not that measles case is epi-linked to any other outbreak that's currently occurring in Hays County, or if it may have been a foreign travel case or a case of wild measles. So that's probably the best answer I can give you at the time. And again, we're working with the patient to get the information of that family member, so that way we can further do our investigation to notify other individuals of potential exposure sites for that person.
And can you just reiterate the time frame of the exposure sites that you mentioned and the sites themselves?
Yeah, absolutely. So the time frame that we have is going to start from May 11th to May 19th. On May 10th, we had the individual visit HEB Plus in Kyle and the Sephora located in Coles in Kyle from the time of 8 a.m. to 4 p.m. Again, it's a broad time due to the passing of time and the patient's recollection of the memory with it. And then the other locations are going to be on May 13th, which is Communicare Kyle Clinic from 11:47 to 12:23, adding an exposure buff of 2:23 p.m. due to the virus persisting in the air and on physical objects, and as well as May 13th at the San Marcos, Texas Department of Public Safety, also sometime from 8 a.m. to 1 p.m., 11:47 to 2:23 p.m. And then on May 16th, the patient visited Ascension Seat in Hays from 12:50 p.m. to 3:30, adding the exposure buff of 5:30 p.m.
So outside of this instance, when was the last time Hays County saw a case of measles?
I'm actually going to probably reference that to our senior epi, Ian Harris. I don't think we have had one in the last decade, but I'll let him.
Hello, Ian Harris, one of the epidemiologists here with the Hays County Health Department. To my recollection, we have never had a true case of measles. We have worked up plenty of them just to rule them out, but never had a confirmed positive to my knowledge.
Alrighty, any last questions? Perfect. So what I want to leave off with is just that individuals, again, to monitor them, those who are exposed at the potential exposure sites, just to monitor themselves for signs and symptoms of measles. Predominantly, that's going to be starting a rash from the mouth down, and then a fever and conjunctivitis, as well as making sure that they are vaccinated to ensure that they won't get measles in the future. If you're not, we really highly recommend talking to your provider to have a conversation of what that looks like for you and your child before getting the vaccine, but it is ultimately the safest way to prevent a infection of measles. Lastly, if you have any information or need some assistance or further clarifying questions, you can always contact the Hays County Health Department at 512-393-5520. We also understand that individuals of Travis County may have traveled into Hays County during those times of exposures, and what we want those Travis County residents to know is to contact Austin Public Health in order to have that, report those cases and signs and symptoms to their health department. All right, thank y'all.
Are you able to give me somebody your name and title? En español. Para Telemundo.
¿Para Telemundo?
Sobre
Ajá, ajá. Lo podríamos hacer esta mañana.